Okay, good afternoon, everyone. Sorry for the delay. We had some technical difficulties, and sorry for those who had a hard time logging on. I'm not sure what was going on there. I'm Francine Leclerc, the project coordinator for Near North Palliative Care. We have Amanda Demott here with us today. She's our student placement, and she's going to do a presentation on schizophrenia in older adults. So if anyone has any questions after the presentation, you may write it in the chat bar and we can do our best to answer any questions that you may have. So Amanda, the floor is yours, and we look forward to your presentation.
Thank you. So schizophrenia in older adults. Oh, why can't I? Oh, there. So the definition of schizophrenia is a chronic brain disorder that affects less than 1% of the population. That's actually Canada and US. So symptoms include delusions. These are false beliefs that are not based in reality. An example of that is you may think that you're being harmed or harassed. Certain gestures or comments are directed at you from somebody who's not there. This occurs in most people with schizophrenia. Hallucinations. These usually involve seeing or hearing things that don't exist. Yet for the person with schizophrenia, they have full force and impact of a normal experience. Hearing voices when no one's around, a lot of them will tell you that they hear colors and see voices, and they can talk to people who aren't there. They often think somebody's standing in front of them, meanwhile there's nobody around. Disorganized thinking or speech. It's effective communication that can be impaired, and answers to questions may be partially or completely unrelated. An example is putting together meaningless words that can be misunderstood or that can't be understood, sometimes known as word salad, which is just a bunch of different words that make zero sense. Negative symptoms, this refers to reduce or the lack of ability to function normally. An example, a person may neglect personal hygiene or appear to have lack of emotion. The person does not make eye contact, no change in facial expression, and speaks in monotone, which is they speak at one level, no expression to what they're saying. Their face does not match any expression, basically like a robot. So other symptoms may include, they can vary in type. The severity comes with over time. Periods of worsening, remission of symptoms. Some symptoms may always be present, others may not always be present. Schizophrenia in men, symptoms typically start earlier to mid-20s or in the mid-20s. And the pictures I have, it just shows you that it's any race, any culture, it's men in general. Schizophrenia in women typically begin in their late 20s, so after what a man would become schizophrenic. And again, it could be any culture, any type of woman, anybody in their late 20s. So suicidal thoughts and behaviors. Suicidal thoughts and behaviors are common among people with schizophrenia. If someone you know has made suicidal attempts, call 911 immediately. They may have done more damage than anticipated. Meanwhile, If they had cut their wrists or their neck, they could have nicked a jugular, doing more damage than what anybody can see through the naked eye. With the wrists, they could have cut tendons that won't allow their hand to move even after they've seen a doctor or seek medical attention. If they have cut any arteries in the legs, on the left leg, it could mean that they've cut their main artery leading to the heart, which could cause a lot of damage, as most people know. Causes of schizophrenia. It's not known to what causes schizophrenia, but researchers believe that it is a combination of genetics, brain chemistry, and environmental contributes to the development of this disorder. Problems with certain naturally occurring brain chemicals, including neurotransmitters called dopamine and glutamate, may be a contributing factor to schizophrenia. Schizophrenia is a brain disease. Questions people ask: can I catch it? Is it spreadable? If I touch you, will I get it too? Can it kill you? The answers to all these questions are no. It is non-contagious. It is not spreadable. You can't catch it from touching somebody or shaking somebody's hand. And it's not a disease that can kill you right away, as it can be controlled. Risk factors include family history, pregnancies and birth complications, taking mind-altering drugs in youth and adulthood or young adulthood, complications. Left untreated, schizophrenia can result in severe problems that affect everyday or every area of the life, social aspects, financial, everything like that. Complications associated with suicide attempts and thoughts of suicide, anxiety disorders and OCD, depression, alcohol and substance abuse, the inability to work or attend school, financial problems, social isolation, health and medical problems can also cause aggressive behavior, although it's uncommon. Diagnosis. Diagnosis of schizophrenia involves ruling out other mental health disorders and determining the symptoms that are not due to substance abuse, medication, or medical condition. Common tests of diagnosis may include, but they're not limited to, a physical exam, a tests and screenings such as an MRI, a CT scan, psychiatric evaluations performed by a doctor or a mental health professional, and the diagnostic criteria must meet the DSM-5. Treatment. Schizophrenia requires lifelong treatment, even when symptoms have subsided, because it's not something that can be cured, but it can be controlled. Treatment team or multidisciplinary team would be a psychologist, a social worker, a psychiatric nurse, case manager, or coordinate care. Medication. There's two generations of antipsychotics. So the first generation of antipsychotics is chlorpheniramine or chlorpheniramine. I can't pronounce them all, so I'm sorry. Flufenazine, haloperidol, and profenazine. Second generation antipsychotics are aripiprazole, asenapine, brexpiprazole, cariprazine, clozapine, olanzapine, risperidone, and risperidone. Interventions: individual therapy, psychotherapy may help to normalize thought patterns. Also, learning to cope with stress and identify early warning signs of relapse can help people with schizophrenia manage their illness. Social skills training. This focuses on improving communication and social interactions and improving the ability to participate in daily activities. So they would have to basically relearn how to be social again. They're not always sure if, they can talk to people, how things are going to come out, if they can do activities with other people. Family therapy. This includes support and education to families dealing with schizophrenia. We can always educate, but we don't give advice. Vocational rehab and support employment. This focuses on helping people with schizophrenia prepare for, find, and keep jobs. Coping and support. Learn about schizophrenia. You can learn through education about the disorder, educate your family and friends, be compassionate, and be patient. Something might not come out as what it seems to be, but we just have to be patient with them and let them talk and get through what they need to get through and let them get out what they need to get out. We may not take it as how they mean it, but we can interpret what they're trying to say. Stay focused, manage schizophrenia, make realistic goals, keep treatment goals in mind, and keep pushing forward. What do you need? The right diagnosis, the right disciplinary team, and the right support. Support is a big thing. With this brain disorder, you need a lot of support to get through it, and a lot of education, a lot of knowledge, and people learn at their own pace. The older adult, the number of people older than 55 with schizophrenia is expected to double during the next 20 years. Research data on older adults with schizophrenia are very limited. Physicians assume that the mental illness in older adults age 55 and over was just part of the aging process. Older adults 55 and over were excluded from any of the research investigations. So as they were doing the research on schizophrenia, they excluded anybody 55 or over due to the assumption that it was just part of the aging process. Mental health nurses need to be cautious in assigning premature labels to older adults with mental illness. It may lead to unsubstantiated assumptions about the level of disability. Major depression is a leading cause of disability. Causes people over 55 years old to change their life course in psychopathology. Schizophrenia in the older adult, this could be caused by the following, or could cause the following: cognitive function, social functioning, physical health issues, various concerns regarding treatments, services, finance, family concerns. People aged 55 and older with long-standing illness such as schizophrenia, bipolar, and chronic depression have been largely invisible to the mental health researchers. Approximately 2% of the population over the age of 54 suffer from a chronic mental illness other than dementia. An examination of schizophrenia in later life, when attained at its most complex and developed forms, may provide many of the keys to the disorder itself. Research and data. There's very little research available on older adults with schizophrenia. Data on the ages 55 to 64 are very difficult to obtain. They are not included as, they're not included as a separate category in most studies. According to the data from the Center of Mental Health Services, the bulk of outpatient services to the elderly were provided by multi-service mental health organizations. Organizations such as inpatient, residential, outpatient, partial care, and it was done by the Development of Veterinarians Affairs Psychiatric Organization. Veterans Affairs, specific data for older adults with schizophrenia are not available, such as war veterans or the ever so famous baby boomers, people over the age of 54 and above. A lot of the blame goes on the aging of the adult, environmental surroundings from teenage to age 45 plus. My conclusion is schizophrenia cannot be cured, but it can be managed and it can be controlled. As an addictions and mental health professional, the only advice I can and want to give is positive and for you. Take everything one day at a time and enjoy each and every day. These are the website resources that I used to collect all my slides. I typed in on Google schizophrenia.com. Then I did the older adults with schizophrenia. I believe Francine had sent me that one. Schizophrenia or suffering from schizophrenia. And I read a bunch of the schizophrenia articles from Ottawa that had a lot of the statistics from where the ages came in and that there wasn't a lot of data on it. I also found this quote on one of the articles. It says, "I'm a 75-year-old adult. I suffer from schizophrenia, but you can't tell. I control my life. It doesn't control me. I love, laugh, and live each day with a smile upon my face. It's time to teach the next generation how to smile, how to live, how to love, and how to cope. We can do anything together." And that's my presentation on schizophrenia in older adults.
Great, thank you so much, Amanda. That was a great presentation.
Thank you.
Does
Sorry, I
anybody
couldn't
have
pronounce some of the medication.
Yeah, I think most of us don't know how to pronounce medication. So
Well,
that's all right.
I have a hard time like speaking like words like that right now, just because of like I recently in February just got 9 teeth removed out of my mouth. So now I have a top denture, so it's hard for me to say some of the words.
All right.
I'm getting there.
Yeah. So Sherry says, good job, Amanda. Does anybody have any questions for Amanda? If you do, you can put it in the chat bar if you have any questions for her. So we'll just give it in a minute, Amanda, and see.
Yeah.
Okay. So no questions. Amanda, thank you very much. It was a great presentation. And it was very, it's good to learn about these things. So thank you very much. And I hope everyone enjoys the rest of their afternoon.
Thank you.
Thanks. Bye, everyone.
Bye.